So if Obamacare actually worked, and if Obamacare actually made healthcare more affordable for people, and it really made healthcare cheaper, then why do we need subsidies funded by taxpayer money just to keep it alive? That doesn't sound right to me. It doesn't sound like a successful plan to me either. I really want y'all to think about this, right? The whole point of Obamacare was to make healthcare affordable for people who cannot afford. They just don't have the P's, and they don't meet the certain threshold to be able to afford healthcare. But if it was really affordable, you wouldn't need government assistance to pay for it, would you?
People do not understand that Obamacare created this awful thing for healthcare. Obamacare created these prices and premiums to where they are, and a lot of people don't understand that. I had a patient, well, actually I had a doctor yesterday tell another doctor that Obamacare is why medication prices are the way they are, because the companies didn't follow through with what they should have, and our government didn't follow through with what they should have. So here we are, a downward spiral to where US citizens or Americans are not able to afford medications that they need. Hearing a doctor say that to another doctor, I was in complete shock. Complete and utter shock. But people don't think about it that way. Obamacare is what started a lot of this insurance and medication and all of this issues that we're having, and it's going to continue until our current government, people that we put in office, the ones we vote to be there, honestly do what is best for us. Until that is done, we're going to keep being in the situation we're in. We're going to keep having patients and people that cannot afford their medications that they need.
Dear President Trump, I know I don't look so good. I've been undergoing chemotherapy since May, and it takes a lot out of you. The good news is that Obamacare is keeping me alive and can cure my stage 4 cancer, but I need to keep my insurance. Your latest plan will put me and millions of other Americans at risk. Throwing us to the mercy of the insurance companies is not the way to go. We need the protections of the Affordable Care Act so that people with pre-existing conditions will be covered. We need somebody that will stand up for us rather than selling us out.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
I have never voted for President Obama, ever. I am a Republican who cursed his name, who falsely accused him, and someone who zealously worked to ensure that he would never be my president. I was diagnosed with a serious autoimmune disease. Now labeled with a pre-existing condition, I am disqualified from any and all health insurance options. Literally a dead man walking. But then this guy signs this bill. And now I have access to health insurance and I receive the care that I so desperately need. I can now say I had a serious autoimmune disease. And to the Republicans who wish to repeal the Affordable Care Act, I plead with you to reconsider. Swallow your pride, as I am doing right now, in front of what I assume are many Democrats, and do what is right. Do what is right for the people.
It wasn't about Democrats or Republicans. It was about our values as Americans and making sure that hardworking Americans like Brent are no longer locked out of health insurance through no fault of their own.
What's up, everybody? Welcome back to the channel. My good name is Gracie D. I hope you all are doing amazing. Thank you so much for clicking on this episode. I really do appreciate your love and support on this channel. So today's episode, there is this question that people are asking themselves: is Trump about to end Obamacare? And is Obamacare a scam? So for those who don't know, Obamacare is a nickname that is used for Affordable Care Act, because I got to understand that most people don't realize that Obamacare is the same as Affordable Care Act. So lately, there have been talks about Trump and his administration plans to roll back or repeal Affordable Care Act. And on this episode, I want us to break down exactly what is going on, what changes are being imposed, and most importantly, how these will impact millions of American citizens. And before we dive in, let's first understand what the Affordable Care Act was designed to do. The Affordable Care Act, which also most people don't know that it's the same as Obamacare, made health insurance more affordable for millions of American citizens. It helped low-income American families get covered through Medicaid expansion, and it gave people subsidies to make private insurance cheaper. It also introduced some key protections like you cannot be denied for a pre-existing condition. You can stay on your parents' insurance until you are 26 years of age, and preventive care like checkups, vaccines, and cancer screenings became free. So when we talk about pre-existing condition, let's say you have something like cancer, diabetes, asthma, before the health insurances companies or these private insurance companies never used to cover for that. But with Obamacare or Affordable Care Act, it was made possible for these insurance companies to cover for that. And with these ACA changes, it made it possible for millions of Americans to get access to health care that they couldn't afford before because of the rules and regulations that were there with private insurance companies. But now under Trump's new administration, there is a renewed effort to roll back many of those protections, which is actually going to be affecting so many American citizens. And now people are coming out saying that Obamacare or ACA is and was a scam because the government have to pay subsidies. It's paying from the taxpayers' money. But I'm asking myself this question. You can also tell me on the comment section if I'm wrong. Why are you okay with your government giving aid to foreign countries like billions and billions of American dollars, but you don't want the government to fund for subsidies that will help actually low-income American citizens to get healthcare? I want us to watch some of these few clips that I've gathered for you guys. Every clip and every stitch that you'll be seeing on this episode, credits belongs to the original creators of these videos that you're seeing on your screens. So I would really love you all to tell me what you think about this episode on the comment section. Do you think Affordable Care Act, aka Obamacare, is a scam? Do you support it? And if you don't, tell us why on the comment section. If you do support Obamacare, also tell us why on the comment section. So let's just dive right ahead and we'll be back with more commentary.
We worked on repealing and replacing Obamacare back in 2017. I still have PTSD from the experience. You remember that John McCain famously did the thumbs down, and effectively by a one-vote margin, the whole effort was defeated. It's a great frustration of mine, and has always been of President Trump's. And we know that American healthcare needs dramatic reform. Let's just state it simply. Obamacare failed the American people. It was promised to be a great success, to make healthcare more affordable. It's done exactly the opposite. And it has been pointed out by everyone that since Obamacare was created in 2010, premiums, the cost of healthcare, have risen exponentially. It's skyrocketed to the point where it's no longer affordable for so many Americans.
Hi, my name is Dr. Rubin, and I want to remind you that prior to the Affordable Care Act, it was difficult for millions of people to get health insurance based on whether they had a pre-existing condition. So as an example, if you had asthma, premiums would be really high and make it basically unaffordable for many people to afford coverage, or some insurers would just not cover you. The Affordable Care Act got rid of that and said that you have to provide coverage regardless of pre-existing conditions. Now, yes, premiums have gone up over the past several years, but when you look at out-of-pocket expenses, it was actually rising at a higher rate prior to the Affordable Care Act compared to what we are seeing right now. One of the strengths of the Affordable Care Act is the fact that they were able to provide millions of more people health insurance coverage, but it is at risk of going away for millions of people because the enhanced subsidies that were put forth, not only from the Affordable Care Act, but from the Inflation Reduction Act, those are about to expire. So when open enrollment begins very shortly, many people are going to see prices go significantly higher because those subsidies have not been renewed, which is partly why the government is shut down right now, because there is a fight to try to get those subsidies back. But in addition, if we're going to just cut these things, the Republicans still have not put out a unified proposal to replace the Affordable Care Act. They keep trying to gut it, but they don't have any plan to replace it. So how are you going to do that if you've got no plan? You're going to end up costing people a lot more in their health care, a lot of headaches for everybody if you don't have a plan put in place. So that's where the issue is that if you're going to dismantle healthcare, what are you going to do to make it better?
The government shutdown continues, and the main sticking point appears to be Obamacare. Obamacare was enacted back in 2010, and it was originally intended to provide some measure of health insurance for people at 400% of the federal poverty level and lower. It is funded by a basic tax credit, and that tax credit is permanent, meaning that Congress doesn't have to reauthorize it on a routine basis. Then, in 2021, Congress approved something called the Enhanced Tax Credit. And what this tax credit did was it greatly expanded the number of people who can participate in Obamacare, people who make more money, and it lowered premiums. The Enhanced Tax Credit does have to be reauthorized by Congress on a routine basis. And that's the sticking point. The Republicans don't want to reauthorize the Enhanced Tax Credit. In fact, in their latest budget, they don't have any money for the Enhanced Tax Credit. The Democrats are saying, well, now hold on. Since we enacted this back in 2021, a lot more people have joined Obamacare. In fact, about 45 million Americans now get their health insurance coverage through Obamacare. And if we don't pass this Enhanced Tax Credit, a lot of people are going to suffer. About 22 million will either pay astronomically higher health care premiums, or they could lose their health insurance altogether. Those health care premium increases are pretty eye-watering. For instance, a family of 4 living in Maine with an annual income of $130,000 would have to pay $16,100 more per year for their health insurance than they have been. A 60-year-old couple living in Maryland would have to pay over $13,000 more than what they're paying right now. In Nevada, that same couple would have to pay over $18,000 more than what they're paying now. And in Kentucky, an unbelievable $23,700 more than what they're paying now. And that's where we're at. The Republicans seem hell-bent on getting rid of the Enhanced Tax Credit, and the Democrats seem hell-bent on not having some of you pay an extra $24,000 a year for your health insurance coverage. I will let you decide who the bad guys are, but I think it's pretty obvious.
Obamacare was not a disaster, and I really wish y'all would stop spreading that lie. And it's got to be because either A, you're too young to remember what the financial market and environment looked like back in like 2006, 2008, or you got a very short memory. I entered the workforce back in 2006, the same year I entered college, and the minimum wage was $5.15 an hour. Maybe 1 or 2 years after that, it was $6.55 an hour. At $5.15 an hour, $6.55 an hour, you were not getting insurance through the company. I remember that vividly. That premium was going to at least eat up 1 week of your check, and you only making $200 a week anyway. And you for damn sure wasn't going to get it privately because the premiums are even higher. This is why people back in the day told y'all, get a job with the post office, get a job with the city, get a job with the state, work for the government. Why? Because you may not get rich working for the government, but them benefits are going to make sure you're taken care of. But if you want to know the value of the ACA, you can just look at the benefits they celebrate. Do you know how many people were denied coverage due to pre-existing conditions? Do you understand how many people had the prices of their insurance jacked up just because they got sick? Y'all are harder on this legislation than y'all are on the companies that cause need for legislation. High premiums existed long before the Affordable Care Act. High deductibles existed long before the Affordable Care Act. Medical debt definitely existed long before the Affordable Care Act. In fact, medical debt has always been one of the leading causes of bankruptcy in the United States. The Affordable Care Act was originally meant to be a step toward universal health care. The problem is nobody else has taken another step to actually accomplish the goal of universal health care for citizens of the United States. Y'all got to start doing some research on your own instead of regurgitating these talking points that are completely unfounded.
Wow, to the Gen Xers, Xennials, Millennials, elder Millennials especially, who are talking about the experiences they had pre-Obamacare or the Affordable Care Act, the ACA, the stories on my last post about all of this is like required reading. And I told my story about how when I first, couldn't get insurance because I had migraines, the stories that you all have shared, oh my gosh, some of the haunting ones that sort of kept coming up is like counting pregnancy as a pre-existing condition and people that had to change employment like midway through a pregnancy and being denied care as a pregnant woman. I mean, it's just shocking that was allowed. Other things include lifetime maxes. Oh my God, the stories of these children who had issues as children, even in the NICU, and their insurances had like an $100,000 lifetime max. That is insanity. I mean, a lot of you all don't know my story, but I triggered a rare disease when I gave birth, and I was on like a ventilator 3 times and in a coma for a bit, and it was so dire. Like, insurance companies have insurance for people like me because now I'm on a drug that's like one of the most expensive infusion drugs. And so anyways, I would be so screwed. Please read those, especially if you're young and you do not remember what it was like. It can show you like how bad it was just like 20 years ago. It's insane to me that people did not make it. Children who reached lifetime maxes, who needed to fundraise for care, who couldn't get access. We've come a long way. And while I think that there are a lot of things about the ACA that need help, by and large, for people who needed access to care, it has been revolutionary. Because before all of this, if you were sick, good luck to you. So anyways, I want to post more. I want to ask some permission for folks to be able to share their stories, but continue to share with me, like, how did you handle it? Like, when you couldn't get insurance, or like sometimes people are like, oh, I literally had like one test that wasn't good, or needed antidepressants, or, it took like literally the bare minimum for them to be like, nope, we're not going to take care of you. That's a pre-existing condition. I'm sorry. Having a uterus seems to also be a pre-existing condition. In this short-term period where someone who said they have concepts of a plan doesn't seem to actually have a plan. So we need to save the ACA because it really helped people. It helped me. It saved my life. I just, even last year, I had this rare disease, got laid off 6 months after going to work, and then, had to be rushed into another emergency surgery to save my life. And thank God I had insurance. So, because I was underemployed working freelance. So, we've got a long way to go, but we've come a long way, baby. Let's keep going.
So what's taking place right now during the government shutdown, they've really paid attention or focused really on ACA, Affordable Care Act, aka Obamacare. There is a bill right now called HR 114, Responsible Path to Full Obamacare Repeal Act. And this bill would completely repeal Obamacare, everything gone by 2026. That includes Medicaid expansion, subsidies, and pre-existing condition protections. If this passes, millions could lose coverage, especially low-income and minority families in the United States of America. So you've seen on these videos of these patients or American citizens who are actually saying how Obamacare has really helped them with their pre-existing conditions. You all know how expensive it is to treat cancer. So with this gone, these patients will not be in a position to afford their health care. Then what does this mean for this patient? They cannot afford their doctor's session because they don't have enough money. So they'll die because they're not getting treatment and they're not able to afford the care that is needed. I keep on asking myself, why is a country like the United States of America not in a position to offer its citizens universal free health care? Honestly, because they're always funding other foreign countries. They just gave 40 billion US dollars to Argentina farmers while their citizens are suffering. People are not in a position to afford their health care. And now they want to do away with the one thing that was really helping millions of American citizens just because the government don't want to fund it. Yes, people are saying affordable care should be affordable, but they're saying it's not affordable because the government have to fund it. What is the problem if the government has to fund it and it's helping millions of American citizens? If it were to me, I wouldn't have a problem when my government is funding my health insurance and I'm paying tax too, because each and every American citizen is paying taxes. And these taxes are the ones that are actually being used when it comes to these low-income earners that cannot afford to pay for these private insurance companies to afford their health care. People should not even be having a discussion of who can afford and who cannot afford to visit their doctor, who can afford to go for their therapy session, who can afford to go for their cancer treatment because they cannot afford it in a country like the United States of America. You're seeing here on these videos, you have millennials that are actually explaining how hard it was for people to get treatment before Obamacare. Now people are complaining because you've only got that part where the government have to fund or give subsidies for Obamacare to be working. And people are saying that this was only to help fund millions of insurance companies out there. But, you know, that is one thing that I don't find a problem with. If it's helping to fund corporations out there and insurance companies, but it's doing what it promised to do, what is the problem? Because honestly, people need healthcare. You've seen these patients here on these videos complaining on how before it was hard for them to be able to afford medical coverage. But right now with Obamacare, it's been made easier for them to get treatment and they're recovering. So with what's going on right now, there is also regulatory changes where Trump's health department is already moving to shorten enrollment periods and make it harder to sign up for ACA plans, aka Obamacare. Fewer outreach programs, more red tape. That means if you miss the window, you might stay uninsured for a whole year. Imagine you stay uninsured for a whole year. God forbid you happen to get in an accident, or you just discover that you have this illness, a lot of money, and at that time you're not insured. Just imagine what's going to happen to you. Like, no one to be sick. No one ever plans for sickness. It's not something like you sit down and know, like, next year on Feb, I'll not be feeling well, so I need to cover myself for that. It's not something that you plan for. So imagine if this window is closed and there are people who will not be able to insure themselves. It's gonna be hard. And right now, as we're seeing how the economy is and how everything is going up, healthcare in the United States of America is quite expensive. Paying for medical bills is quite expensive. And the craziest part is that, I got to learn how expensive it is to give birth in the United States of America. Like, you have to pay thousands of US dollars just for you to go and deliver your baby. It's so crazy because it's all about money. And I wish the American citizens can just understand that the enemy is not that black person. The enemy is not that white person. The enemy is not that illegal immigrant or those immigrants that you want so bad to leave your country. But the billionaires, the politicians, and these corporations that are actually making everything expensive for you. People are okay for these politicians to lower tax pays for these billionaires, to cut tax for these billionaires. But you're not okay for the government to fund subsidies for Obamacare to keep going, or Affordable Care Act to keep on working and help millions of American citizens. Like, I don't understand these. I've been trying to think, like, why are people really complaining about Affordable Care Act if it's been helping millions of American citizens? I don't see this same rage when it comes to America funding foreign countries, of giving aid of billions of American dollars to foreign countries. But now when it comes to subsidies that are actually helping and benefiting American citizens, that's where you all draw the line. Like, that's where you're like, no, it's not affordable anymore. We don't need it anymore. Maybe you all can actually make me understand why so many people are actually against Affordable Care Act at this moment. Under the 2025 budget plan, Medicaid recipients could be required to prove they are working or volunteering. Oh, that sounds good, right? But in practice, these rules often cause people to lose coverage just because of paperwork barriers. Sometimes maybe you don't have the paperwork, maybe you're working and all that, but you end up losing your coverage because you cannot prove that, or because you're not volunteering anywhere. For expiring tax credits, the government plans to let the enhanced subsidies. The government expiring tax credits. There is expiring tax credits. The government plans to let enhanced ACA subsidies, which helps lower premiums, expire. And that means the cost of coverage could more than double for millions of American citizens. And we've actually been seeing videos of people saying now, after, whatever is happening, they received their letter or they received a mail where their costs have been doubled of what they were actually paying before. And people are blaming this all on Obama and Affordable Care Act and the Democrats. But I understand there is a reason for people getting angry, because most people didn't understand the government have to pay or fund for subsidies for the Affordable Care Act to be affordable. But this still same government can do that if they really want to help the American citizens. What I understand is that, yes, it's taking a lot of money from the government. But I also understand that there is a lot of money that is taken from the government or American taxpayers' money to fund other foreign countries. So for me, honestly, I wouldn't have a problem if the government is taking money to fund and help American citizens acquire or have coverage of their health care. Another one is marketplace rule changes. New rules could allow insurance companies to reduce what they cover, add fees, or narrow your choices of doctors. Basically, you pay more and get less, which has not been the case with Affordable Care Act. So what happens if Medicaid expansions is rolled back or premiums shoot up? That means less access to doctors, medicine, and preventive care to American citizens. And experts are actually saying up to 17 million people could lose health coverage if these changes move forward. And this is not just about a number. Like, that might be your cousin, that might be your neighbor, your mother, your father, your child that was born with the conditions that needs a lifetime, healthcare coverage. And without this year, so many people are gonna lose their lives because they cannot afford their healthcare. People are maybe wondering why this is being made political and why people are really paying attention to this discussion. It's because Trump and his administration and many Republicans argue that ACA is too expensive and gives the government too much control over healthcare. And they believe in more free market system where private insurance companies compete. But you listening, and you've heard people that have actually benefiting from Affordable Care Act, because so many of the people that are actually seeing, complaining and saying negative things about Affordable Care Act are people that, number one, don't have patients that have pre-existing conditions, are people that they can afford to, pay with cash or whatever means they can pay for their doctor's visits. There are people who can afford to pay maternity for their wives or for themselves. So for them, they've never been in that position to understand how it feels like when you don't have healthcare coverage, when ACA was not there anymore. There are people who didn't feel the pinch before because they've never been sick in their life. They don't deal with cancer patients. They don't deal with diabetic patients. They don't deal with patients that are suffering from asthma, honestly. Because if you're someone that is suffering from all these conditions and Affordable Care Act has not served you, let us know down on the comment section, because of all the videos that I've seen of people talking about ACA or Obamacare are people that are actually just talking positive of how it has really helped them. And I've not seen any patient who's come forward and say how much they've suffered because of Affordable Care Act. None of them. It's just the government that wanting this thing to be free market and insurance companies to compete each other and do things as they wish. Now it's the right time for American citizens to sit down and understand that it's not just about policy. It's about what kind of a country that you want, where healthcare is a privilege or a right to each and every other American citizen. I want you all to tell me what you all think about this on the comment section. I'd really love to hear, especially from people that have had Affordable Care Act and have pre-existing conditions, or people who could not afford health insurance before, and Obamacare or Affordable Care Act has now helped them to be able to afford health care. Let me know what you all think about this. Do you support this plan of, this government doing away with aka Obamacare, or do you want Obamacare to remain because it has really helped you? And for those people who are against this and don't have any illness, never suffered any serious illness, never any day lacked money to use a doctor out for your medicine and all that, also let me know why you're not supporting Affordable Care or aka Obamacare on the comment section. I really do appreciate your love and support on this channel. Thank you so much for watching up to this part. Make sure to subscribe to the channel if you haven't, and until the next episode, have a great weekend.